Welcome back to my YouTube channel. My name is Juliet, and if you're new here, I'm a registered nurse who is interested in geriatrics. In today's episode, I will be talking about what mild cognitive impairment is. Before we dive into mild cognitive impairment, let's start by understanding what cognition is. Cognition is a term for the mental processes that takes place in the brain, such as thinking, memory, language, perception, learning, and concentration. Cognitive impairment means that there is a problem with the brain function. The brain is not working as it should be working. So the older adult would experience confusion, forgetfulness, even become delusional. It is normal aging process for older people to present with subtle cognitive decline. This decline has no or minor clinical impact. It is not a sign of neurodegenerative disease. Yes, it is normal aging process for older people to have decreased ability to multitask, to have diminished ability to learn new information. They take time to recall. It is longer for older people to remember things, and they also have slow response time. I am sure you're wondering by now, what is mild cognitive impairment? Mild cognitive impairment is loss in memory and thinking skills that exceeds what is expected for an older person's age and educational level. So in mild cognitive impairment, the older person still retains their independence in performing activities of daily living. They have still their autonomy, and they can still carry out activities of daily living. With mild cognitive impairment, older people would present with telling themselves stories, repeating themselves, misplacing their items. They often would tell the same stories because they have probably forgotten they've said the story before, and also they would have problem finding words to describe items. They have a poor judgment, so that is why older adults become at risk of being financially abused, and they become good victims for scamming. Also, older adults can also present with forgetting the dates they have, forgetting appointments, forgetting the date of the year, forgetting the month. So this is concerning because it's normal for older adults to forget the day or to forget the date, but to forget the year they are in and to forget the month is quite concerning. In mild cognitive impairment, it is common to see that older adults would require greater efforts or require compensatory strategies to carry out activities of daily living. What do I mean? So if normally the older adult requires an hour to get a task done, once there is loss in memory and thinking skills, that task might require 3 hours to become accomplished. The most important thing is the task is accomplished, but it will take longer time. You can also find older adults needing probably someone to call them daily to remind them of things to be done, whereas previously they just needed to write it down and they would remember. In summary, how do you determine if an older adult is experiencing mild cognitive impairment? So with older adults, you might observe that there is a loss in memory and thinking skills. However, you have no concern leaving them and traveling because you know they're still able to perform activities of daily living. They're still independent with that. They just might take a longer time and they just might need a bit of reminder. So that is when you know that it is mild cognitive impairment, because the memory loss is greater than what is expected in their particular age. So what are the risk factors for mild cognitive impairment? Age is definitely one. Vitamin B deficiency, high blood pressure, depression, anxiety, isolation can all result in increasing the risk of developing mild cognitive impairment. Mild cognitive impairment can be reversible and can progress to a condition known as dementia. In order to deal with mild cognitive impairment, it's important for older adults to have a good diet, to care for their mental health, to be physically active, manage the blood pressure, and also if they have vitamin B deficiency, they should be placed on vitamin B12 tablets. So if this video has been informative and has supported your understanding of what mild cognitive impairment is, kindly like, comment, and also share, and please do not forget to subscribe to my YouTube channel.